If you haven't been keeping up with the 2020 race, we're going to check in on it now, because if you watch the last debate, a lot of questions about how Senator Elizabeth Warren intends to pay for Medicare for all. Well, today she actually released her plan, and I want to bring in our Deputy Political Director, Mary Alice Parks, in our D.C. Bureau. Mary Alice, I just want you to tell us how this is going to work. That's what everyone wants to know.
Right. Well, Senator Elizabeth Warren has said she has a plan for everything, and now she finally has a plan for this. You're exactly right that the questions continued to dodge her everywhere she went, not only from reporters, but even from voters on the campaign trail were saying day in and day out, you got to tell us how you're going to pay for this, because we know that a Medicare for all plan would be a huge expense for the federal government. In principle, what she is proposing, along with Senator Bernie Sanders, is that the federal government would provide free health insurance to every American, and so there wouldn't be those deductibles and co-pays or insurance premiums. And so that's really expensive. So you're right. We now finally have a plan from Senator Elizabeth Warren that covers about $20 trillion for 10 years. So how does she propose paying for it? Largely, she will change her wealth tax. She already has proposed a tax on the wealthiest Americans. This would increase the tax to 6% on every dollar for those who have $1 billion in assets and savings. She also proposes big cuts in military spending, but that last bullet point there is really important. She is proposing that $8.8 trillion comes from private companies that already currently pay for private insurance for their employees. They would continue to pay. They would just pay the federal government more in taxes so that the federal government in turn could provide health insurance.
Yeah, so this was just released today, but have you heard any of the concerns that people may have about this plan? Like, do people have to abandon their private plans that they have right now?
Sure. A lot of her opponents say that her math doesn't quite add up. There are more moderate Democrats who say that this is just not realistic. And yes, there's also that political concern. There are a lot of Democrats who say this is not a winning position to tell the average American that they would have to give up their private health insurance, which they might like, in order to get health insurance from the federal government. But Senator Warren and Senator Bernie Sanders seem to be full steam ahead with this idea. They say that people don't like their insurance, they just like their doctors.
All right, Mary Alice Parks in our D.C. Bureau, thank you for the insight. And to continue this discussion, I want to bring in the former North Dakota Senator Heidi Heitkamp, also an ABC News contributor. She joins us on the phone. What do you think of this plan?
Well, I think that, once again, the devil's in the details, and it's really too early for people to evaluate. What's probably going to be more interesting is to see what other Democratic candidates do with this plan. Are they going to be hypercritical? What is the mayor going to say? What is Amy Klobuchar going to say? What are people going to say about this plan itself?
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.